Topical corticosteroids really are quite effective both to treat the active inflammation, really that idea of reactive therapy and treating an active flare, as well as disease prophylaxis, this idea of proactive treatment and prevention of flare-ups in patients who are prone to those. For acute treatment, one can use intermediate or high potency topical corticosteroids. For prophylaxis, in truth, one can use lower frequency of medium and higher potency topical steroids as well, but often we'll use lower potency corticosteroids to try to reduce the potential for adverse events in those patients. Frequency is really what differs depending on the approach. When you're treating the acute inflammatory process or the reactive approach, we would use twice daily application is the general approach. For proactive maintenance, we would typically say once or twice a week on those areas prone to flaring in order to reduce flares. On occasion, we can use even 3 times a week for shorter bursts. But once you start crossing beyond the twice weekly long-term use, you really do run into that potential risk of steroid atrophy. So how much quantity should be put on? Often patients either are counseled or at least they think that the way to put this on is to take nanogram size amounts and rubbing it in to the point where even a microscope could barely find it. And in fact, we know that the appropriate quantity and guidance that we should give is really the fingertip unit. 1 fingertip unit of topical corticosteroid would be appropriate for a surface area equivalent to about 2 palms worth. So that is an important aspect. They really need to apply appropriate quantities. Of course, we have caution around areas of thin skin and really any part of the body with long-term use. And in terms of the adverse events, the things that we are concerned about really are mostly local in terms of acneiform or rosacea-like eruptions, potentially focal hypertrichosis, and then really those issues around steroid atrophy or thinning of the skin where one may see more translucence of the skin, stria, greater perception of telangiectasias and purpura, etc. And we believe that it's fairly rare that systemic adverse events happen, although some of the older data have suggested that you may have a transient adrenal axis suppression, but it really doesn't seem to be long-standing issues very commonly.